Welcome to the 20th Annual Virtual Health Literacy Conference of the Institute for Healthcare Advancement. We appreciate your joining this pre-conference session, and we'd like to introduce ourselves. I'm Russ Bennett, a consultant to IHA, working here from California, and my colleague, Camino, is in Mexico. And Hari, would you introduce yourself?
Hi, everyone. Yes, I'm Director General to Satya Social Purpose Communication. We're a studio that advocates for health literacy and social purpose causes in the Hispanic market at large.
Our topic today is building health literacy awareness in Mexico, the pilot process that we've gone through, and some thoughts for the future. Today we'll talk about our pilot program strategy. We'll discuss some cross-cultural differences and the adaptation process of the materials that we prepared for Mexico. We'll talk about exploring other media and digital resources. And then briefly at the end, we'll discuss our vision to grow health literacy awareness in Mexico. So this is Mexico. It's a country of 130 million people. It's the 16th largest economy in the world. It's a young country with a median age of 29 years old, but more than 30% of the population, and that's over 38.5 million people, are children and adolescents from 0 to 17 years of age. The health of Mexicans and the main causes of mortality are listed in this chart. But in 2017, over 700,000 deaths were registered in Mexico, of which slightly over half, some 56%, were men. Most of the causes of death in Mexico are preventable diseases, and you can extend the healthy years of life by increasing health literacy. It is striking that the highest number of deaths in the total population occurred in children under 1 year of age. These were due to respiratory diseases in the perinatal period, congenital cardiovascular malformations, and accidents. And you can see here the diseases and the causes of mortality in the general population, adult males, adult females, and young people under 15 years of age. We believe that health literacy will make a significant contribution to improving Mexicans' health and have a positive impact on reducing mortality from preventable causes. So what is health insurance coverage in Mexico? Mostly, it's public health insurance programs. The Mexican Social Security Program, the ISSSTE for federal government workers, the state-level ISSSTE programs that we'll talk more about, Pemex, the petroleum company, the defense and Navy health programs, and private medical insurance. But private medical insurance is relatively small. Only less than 8% of the population is covered by private health insurance. The problem in Mexico over the last few months has been a series of failed strategies around COVID-19. As of late April 2021, 230,000 official COVID-related deaths were registered, plus another 180,000 deaths unaccounted for but related. So nearly 400,000 people have died. Only 5 to 6% of the total population has been vaccinated, and less than 1% has had the course of 2 vaccinations. And there is a significant vaccine hesitancy in Mexico due to low health literacy. Most health professionals in the private sector are lagging in vaccination. And there is a state map with a red light system, which is usually ignored. There is an irregular official communication strategy. And even this week, there have been contradictions in the level of COVID infections, whether it's growing or not growing, coming from different public officials. However, holiday destinations are fully booked. The AMA Foundation tells us that health literacy skills are a stronger predictor of an individual's health status than age, income, employment status, education level, or racial and ethnic group. And we know in the US that people with low health literacy are more likely to smoke, to have diets high in salt, cholesterol, and fat, to take their medications incorrectly, to suffer from preventable illnesses, to visit the emergency room more frequently, and to have poor health. And the same goes for people with low health literacy that are less likely to exercise, to be able to read a thermometer correctly, to use an asthma inhaler properly, to maintain good control of their diabetes, and to know early symptoms of stroke or heart attack. And if you think back to the slide of the causes of mortality in Mexico, all of these relate directly to Mexico's poor health outcomes and mortality reasons. Health literacy in Mexico has not been officially measured, but for projection purposes, we are assuming that health literacy in Mexico is similar to health literacy in the US Hispanic population, which has been measured. In the US, while 35% of the overall population has basic or below basic health literacy, 65% of Hispanic adults have basic or below basic health literacy. So we normally talk about the health literacy levels being proficient, intermediate, basic, and below basic. And these are some of the sample tasks that help us measure health literacy. But if you look at the general population, 12% are proficient and only 4% of Hispanics are proficient. And if you go down to below basic, the general population has 14% below basic, but Hispanics are 41% below basic.
Sure, Ross. The idea behind our strategy was to make parents' life easier, because in the context of such depressed economy and such high rates of chronic diseases, mainly diabetes, um, the family life at large needs a guide. So we focused in the central part of Mexico. This is the most populated region, and especially in the state of Mexico, Estado de Mexico. This specific state is one of the most populated in the country, with 70 million people, and a working class, basically working class socioeconomical level population that is attended by the ISSEMyM. This is a public health entity that serves 1.8 million people, most of which are basically state employees, school teachers, policemen, office staff, etc. Among others, pensioners and affiliated families create this ecosystem, which is reputed to be a very efficient health public health entity in Mexico. ISSEMyM has over 110 healthcare units, okay, hospitals, medical offices, mobile health units, and these provide a total of 3.2 million total consults a year, okay? So according to their statistics, what we found is that on a yearly basis, around 7,500 new births are attended at 17 health units equipped for maternity and deliveries. And this was our playing field. This is exactly where we focused the challenge we're really going deep into now. So the idea was to introduce the classic book, What to Do When Your Child is Sick. As you know, this book has been printed more than 5 million times and has been translated to several languages. IHA developed this title as a means of promoting health literacy into new generations of mothers and fathers. So when we presented to the new leadership of to the institution's new leadership, it was taken as a very interesting approach, because what they had so far presented or delivered as health literacy materials were just scattered pamphlets. Having assembled in just one book with over 70 topics in a comprehensible guide was a major breakthrough. Okay, so the idea was that each newborn, remember we said 7,500 births take place in a year. Out of those, each of these would exit the hospital with a complimentary diaper bag that and the book inside of it to help new parents auto triage at home and increase parents' confidence, and thus release pressure on the already overburdened services, especially the ERs. In Mexico, it's referred as a green code, a yellow code, or a red code. But if you visit the ER just with a pimple in your back, which is a true story, what you're doing is creating a longer waiting time, because you don't trust that you'll be attended by a physician early enough. And this is a culture that needs to be changed. And this is also one of the interests that at large the institution could save important resources and financial resources if these overburdened services could be relieved by the use of these guides. Okay, so the program prerequisites would be achieving compliance with Mexico's federal and state normativity. We're talking here about more than 74 codes, rules, and manuals. Okay, without distorting the easy to read and understand original format. Maximizing cultural competency by including local terms and protocols, respecting the ISSEMyM's landmark programs, and these are the breastfeeding and the vaccine protocols, which they are very proud of, and they've been pushing and communicating for decades. Thus, we needed to honor that and include that. And also training the ISSEMyM's staff in health literacy, best practices at clinics and hospitals. And finally, to perform qualitative impact evaluation. Our adaptation process had 5 stages, which we will see in detail in the coming slides. Our first step was a general scan by a recognized team of Mexican pediatric experts to assess that all content meets the requirements of the local normativity. Mexican health is regulated under a complex system of laws, regulations, official Mexican norms called NOMs, and different codes and guides. What you see at the right is just to give you a feeling of the actual number. This is just an excerpt of the actual number that we stacked one on top of the other to greenlight our process and see that there was a match between the original American text and what the norms in Mexico were requiring to express. We're talking about nearly 74 such regulations for this process, which roughly took about 4 months to complete. Step number 2 was including the specific topics, procedures, and terms of the Mexican normativity in the existing chapters, as we said, but keenly respecting the plain language use and short phrase composition format. We needed to be also respectful and honor the original text, but intersecting, for example, insects and dog bites, which are treated very differently in Mexico than in the US, and that created lengthier phrases for the Mexican market that needed to be adapted to plain language. What you see at the right are the local breastfeeding campaigns that, as I referred earlier, had been communicated to the public for decades for the ISSEMyM. So these were included at the end to give an even more homey touch to this edition of the book. Steps 3 and 4 basically were to exclude certain concepts contrary to the laws or local customs. For example, in Mexico, you don't reach out to call your doctor, which might be a common thing in the US, but it's not an actual Mexican practice among public health users. They would, as I said earlier, just go queue in the ER line and wait to be attended. And these needed to be rephrased. So another part was adapting, of course, the measurement scales from imperial to decimal. Step number 5 was the review process of illustrations and the cover itself. Illustrations could be interpreted differently than intended. For example, medicine bottles, uncommon in Mexico, or medicine names, along with other illustrations that were necessary, such as local insects or spiders that could bite newborns. And what you see at the right is how we approach this, also branding and creating a local version. At the left, you can see the original cover by the classic, the original yellow cover by IHA. And to the right, you can see the adapted and rebranded cover we designed to meet the state of Mexico and the local government's brand guidelines as well. So now let's listen directly to our end users. As we said, we performed qualitative impact measurements, and the testimonials really give the flavor of the use and the appropriation of these guides for these new families and new mothers. So let's listen to these testimonials.
A veces, pues como lo había mencionado, como mamá primeriza, a veces se desconocen muchas cosas y pues sí, el miedo de que pues no esté actuando uno pues de manera correcta o adecuada.
Ya buscas y ahí te viene que porque son los primeros días, que en cuánto tiempo más o menos se debe de quitar, y si no, también viene que los casos de urgencia, ¿cuándo es cuando debes de acudir en el hospital?
Pero a mi parecer están bien explicadas, ¿no? Como por ejemplo esta situación de la fiebre, de los grados en los que se mide la temperatura, pero sí te explica, ¿no? La temperatura se mide así.
Para mantener la calma y sobre todo saber qué hacer, no nada más agarrar, llegar y ya está presentando esto, no se le quita lo amarillo, está enfermo y córrele y llegas espantado, ¿no? Sino saber y tener esas respuestas claras, ¿no?
Pero sí, viene información muy buena, pues que se puede compartir, porque también viene información para niños ya un poquito más grandecitos.
Now, talking about the program implementation, we focused on 3 basic services. One was the Train the Trainers program, where we divided regionally into groups over 100 health professionals who attended these in-person trainings. But then they would cascade train and receive the manuals to reach another 80 or more health professionals in their local clinics. Teachback was exercised as well during these training sessions with specific practical exercises and a book pitch role modeling that was performed. This is important because the health personnel at the ISSEMyM is very used just to handle a pamphlet and, greet the person goodbye or say goodbye. But introducing a more useful and content-rich guide as this book required to role model how to approach the parent and how to pitch the use and the benefit that a guide such as this could render to them when they got home. And this model was like a 2-minute conversation that we performed and made sure that the required teach-back technique was met. Impact evaluation, as we said, covered a pre and a post survey, and also the testimonial of video recordings as we saw. And now let's hear it in the terms and the wording of ISSEMyM doctors. What you're about to see is the result of these trainings, and it's a montage where we present how the book was received and positioning that they learned as a result of the sessions of our program implementation. Let's watch it.
Honestamente yo nunca había visto un libro que estuviera desarrollado de esta forma, lo clásico, guías de práctica clínica, lineamientos, o folletos que se dan en los centros de salud, siempre lo manejan de una manera, pregunta básica y respuesta básica, pero no van más allá, no llevan una secuencia, un orden.
Páginas viene el contenido del libro. Si usted tiene alguna duda, tiene alguno de estos síntomas, es porque su bebé presenta cólicos. ¿Y qué es lo que puede hacer usted en casa?
Puedo hacer en casa antes de acudir a un centro de atención médica, pero hay que conocer un poco más sobre los síntomas que su hijo puede presentar, para que usted determine si es adecuado atenderlo en primer momento en su domicilio o acudir al médico a la unidad.
Es una herramienta que ayuda a evitar en algunos, como tal código verde, que no lo requieren tanta atención y que podría ayudar al papá a mejorarlo en su casa y el siguiente día acudir a su consulta.
Y dejar de tenerle miedo a la enfermedad, ¿sí? Saber qué hacer para posteriormente acudir a los hospitales, si es necesario.
La verdad, dado el tipo de población que nosotros manejamos en ISSEMyM, con niveles académicos en algunos licenciatura, posgrados, etcétera, pero esto no significa que su nivel de comprensión en el aspecto de salud sea acorde al nivel de escolaridad. Entonces yo creo que esto sí va a servir mucho.
Se me hace un libro muy exitoso, porque pensamos en el paciente y eso es lo que el paciente requiere hoy por hoy. Requiere que estemos pensando en ellos, que le demos cosas productivas para su salud. Ellos siempre están pensando en su salud y se dan cuenta que el hospital o ISSEMyM tiene la visión, que es lo principal y el objetivo, que es el paciente.
Ese es el objetivo, el empoderamiento de su propia salud. Es darles las herramientas, y una de las herramientas es el conocimiento. El conocimiento se le da, el tratamiento se le da y pues debemos de tener mayor efectividad en su salud, pero siempre empoderamiento.
Y tenemos toda la seguridad que vamos a orientar a los usuarios y derechohabientes en el manejo de esta información para que cada día sea más factible para ellos la revisión de estos problemas de salud.
También va a ver qué puede hacer usted en casa sin necesidad de acudir al servicio de urgencias.
Lo ideal sería que se hiciera una difusión, no solamente con los volúmenes que tenemos ahorita, sino que una difusión masiva, y eso pues, nos va a ayudar muchísimo. Yo creo que es una buena iniciativa a quien se le ocurrió, y sobre todo también hay algo muy importante, a las personas que van a distribuir este libro, la capacitación de que sí se menciona hay que hacerla porque...
A mí me llegaron primero de inicio solo los libros, no sabíamos de qué se trataba, la indicación era de tener hasta que no tuviéramos la capacitación y efectivamente se necesita tener conocimiento sobre el libro, qué cosa vamos a brindar, qué puede, la renuencia a la que nos podemos presentar y cómo manejarla.
Le decimos a la persona, vamos a ver qué hay en el libro, abra la primera página, abra la primera página.
¿Qué es lo que tienes que hacer cuando tu hijo hijo se enferma.
Entonces, la verdad que fue una situación clave para poder ahora sí difundir con conocimiento, ¿no? Y valorar, porque ahora pues todo el mundo lo quiere, porque ahora lo conocemos.
So in the end, this is our case study for the ISSEMyM project. And we were informed that after the 2-year period, the institution estimates that 60,000 people had been reached by the project. How they got to this number, it's basically multiplying the 15,000 books. Remember, we said 7,500 birth cases a year. So if you go that across 2 years, it gives you 15,000. And when those books reached the homes of these families, the estimation was that about 4 people with the pass along concept could use or get the benefit of the guides. Now let's take a look at other awareness raising activities in Mexico. We have had explored partnerships with several institutions and basically with media. And what you see is the Saludiario magazine. And it's the premier digital medium in Spanish to address the main business concerns of doctors, hospitals, clinics through editorial content, disseminating national and international news from the health sector, as well as specialized research and interesting marketing data for doctors, residents, and health professionals. Russel and I had contributed with over 40 weekly columns on health literacy and related topics targeted at raising the awareness of health literacy among Mexican physicians and health administrators. Our articles followed a series of webinars that, with the help of Saludiario and their core brands, reached an estimated attendance of 800 people. This was during the hardest months of the pandemic. As you know, everyone was exploring the webinar approach, and so did we, with excellent results directed at various groups, you know, among which we can name physicians, corporations, healthcare institutions, other medical providers, and even other agencies. We have also explored how technology for a grassroots change can drastically make an impact in health literacy awareness. And the project we have partnership with requires a 4-fold phase that starts with the demographic research, health plan design, implementation, and follow-up to a program. And what we're talking about here is basically understanding the data of a locality. Okay, we're talking here about a county or a municipality, and how to reach this population, designing health plans that meet their specific population needs, where maybe you have seniors more than kids, or you have a more acute obesity problem, or sedentarism. All these data, which is public, could be taken into a health plan design that reached out through a mobile app, where each user creates its own profile by filling out a biometric data interactive form. So to give you a feeling of how this is, we call it the Healthy Counties app. And it begins by registering new users and requesting them to fill out what they're interested in: nutrition, sports, health, mental health, quitting smoking, weight control, for example, and following a questionnaire, we would get to meet these users and present them with a health plan that involved a more active life health style or specific health literacy materials that could be at their reach. For example, if they replied, yes, we have three siblings at home, we knew that the taken from our health guides, we could reach them with these self-triage materials that we've been discussing. This mobile app can also be monitored by the local authority, and this gives an even bigger impact because you can bridge the divide between local authorities and citizenship by making maybe physical events, or providing them with some sort of agenda to visit the health center. So it's also bridging the divide between the digital world and the physical world through a mobile app, always at hand and ever increasing in contents as we go along with this Healthy Counties app project. This is important also because in Mexico, the growth of digital devices and the internet through mobile is staggeringly rapid. So the print world for health guides has its place, but also working with our devices creates an even stronger and more efficient way to maximize the health literacy materials into everyday human behavior. Okay, so to summarize, the Healthy Counties app called Bienestar en tu Municipio is being developed by in an international consortium of Spanish companies and Mexican companies. And we've been asked to deliver and adapt health literacy materials that can fit the wellness plans that the citizens get. And this is important because earlier I mentioned health plans, meaning the health guide plans or the wellness plans that adjust to the individual's profile. And also the personal data that's been input is absolutely secured. In Mexico, authorities will only review it in an aggregate basis and can only have the access to a general dashboard of how the program is marching along in the municipality or the county. So another approach we've taken is creating partnerships with the corporate sector. Wellness for the corporate sector is a great opportunity that we see that hasn't been tapped yet. This is due to the fact that Mexican workforce is under a great stress. We are, unfortunately, among developed nations, the country that puts forth more work hours a week. And this, you can imagine, has such a great impact in stress and in the performance of workers all over the country. Unfortunately, this has been the norm. Fortunately, the pandemic has brought new legislations, and it's great that we are on the verge of creating even more ambitious programs. And this is why we partnered with the Workplace Wellness Council Mexico. And I would like to show you a message by her president, Ángeles de Gives, conveying the excitement that we feel about reaching out with health literacy and creating a different work mindset and a different work culture that can even go and trickle down into homes. Let's watch Ángeles' message.
Hello everyone, my name is Ángeles de Gives. I am the president of the Workplace Wellness Council in Mexico. My function mainly is to build up a culture of prevention through promoting health within different industries and within and among companies that may be large, medium, or small sized. Unfortunately, health literacy in Mexico is underdeveloped. There are great opportunities to be created in educating the public and empowering them for better health outcomes through business strategies, through academic and also social activities that we can do together to also create understandable and easy materials for people, especially in the corporate sector, as I mentioned, the workplace, but also, I'll say, within cities. Actually, right now, the Workplace Wellness Council is working in this promotion of health in different small places around the country, small cities. So the idea really is to try to get as many people as possible, to try to reach as many people as possible, and to talk about this very important topic, health literacy. Therefore, this alliance, this synergy with Satya, very important for us, with CHIE Camino.
So we've looked at some of the health literacy challenges of Hispanics in the US briefly, and we've talked a lot about making health literacy culturally competent to raise awareness in Mexico. But there's a third culture that is both Mexico and the US, and that is the fact that the US and Mexico share a 2,000-mile border with a population of about 15 million. If you go 100 kilometers north and 100 kilometers south of the border. That population in the border region is expected to double by the year 2025. It's a dynamic region, but it's medically underserved. It has, of course, a high Hispanic population and a high use of the Spanish language. But although separated by a political border, the region is joined by cultural and family connections. It's an area of health professional shortages that serves a population with pressing health and social needs, higher uninsured rates, high rates of migration, inequitable health conditions, and a high rate of poverty. And overlaying all of this is a low or uneven awareness of the importance of health literacy. So the last in-person public conference that we were able to have was February 28th of 2020. And it was IHA's first health literacy conference at the US-Mexico border. It was held in the Rio Grande Valley in Harlingen, Texas, and it was highly successful, bringing in 140 in-person attendees where training and CEs were provided. Of these attendees, over 50 community health workers or promotores were trained. Let's listen to a message from Dr. Frank Fernandez from the National Hispanic Medical Association about the importance of health literacy in the US-Mexico border region.
So roughly about 60% of this area is literate, and so you then look at issues regarding health issues and health matters, whether it's across the life cycle, so whether it's with kids or with older adults. And what you find is that there's a dearth of information and actually misinformation oftentimes about the things that are more threatening or challenging for individuals in this community, as well as different options for care.
So now we talk about building our vision, and we look at 3 growing sectors where our vision is to grow awareness of health literacy in a comprehensive way. We think about health literacy for employers and organizations by creating awareness of the attributes of a health literate organization, to invite for-profit and nonprofit organizations to collaborate in taking concrete steps to increase their organizational health literacy, and to do pilot projects to demonstrate the return on investment of investing in health literacy. We're looking, secondly, at health literacy for government organizations, and that is to develop health literacy goals within the healthy municipality concept that Harry discussed, and their program, and to create awareness at 3 levels of government: the national government or federal, the state, and the municipal, to develop awareness of the attributes about public health leadership, priorities, training, and access. And then to encourage government to create plain language guidelines, such as the class standards and others that we have in the United States. And then health literacy for providers and health institutions, to create awareness of health literacy assessment tools, which aren't really utilized in Mexico yet, and to create awareness of the importance of training their workforce in health literacy. All of this can be summarized with our vision of making the awareness of health literacy and its value to individuals, families, and organizations in Mexico a very important next step in what we do, supporting the efforts of the Institute for Healthcare Advancement and the community of people who are interested in health literacy and extending it internationally. Thank you. And we thank you and offer that you can connect with both of us or either of us. Hari's email is hari@satya.mx, and mine is bennett.consult@outlook.com. We look forward to hearing from you.
Thank you, Ross. It's always a pleasure to share these spaces together. And we hope that you acquired a new perspective on improving health literacy across borders and cultures through our presentation, with the idea that these materials may be extensible to other Hispanic Latino countries other than Mexico through the agency of our consultation and through your plans to create a broader, stronger health literacy culture, which of course starts with the awareness that we've been discussing so far. Thank you so much.